Sandhoff disease by Ruby, Ashleigh, Marvin, and Aurora. Sandhoff disease is a rare genetic disorder primarily caused by mutations in the HEXB gene. These mutations result in reduced or absent activity of enzyme beta hexoaminidase B, which breaks down specific lipids in the body, particularly GM2 gangliosides. The accumulation of these lipids in the brain and other tissues lead to the manifestation of the disease. Sandhoff disease, with its autosomal recessive inherited pattern, typically manifests in early childhood or infancy. As the disease progresses, it can lead to severe cognitive impairment and loss of motor skills. Early diagnosis and supportive care are essential for improving the quality of life of the infected individuals. Sandhoff disease is primarily associated with specific genetic risk factors. The most significant risk factor is the inheritance of the mutation in the HEXB gene, which follows an autosomal recessive pattern. This means both parents must carry a copy of the mutated gene for their child to be affected. Carriers of the mutation typically do not exhibit symptoms. Therefore, genetic testing plays a crucial role in identifying at risk individuals as symptoms may not be present. While environmental factors have not been strongly linked to the development of Sandhoff disease, family history awareness and genetic counseling play a crucial role in identifying at risk individuals and effectively managing the condition.
The classic form of Sandhoff disease occurs in infants. Infants may appear to be healthy at birth but then eventually will begin to show symptoms around 3 to 6 months of age. These signs and symptoms may include abnormal bone development, cherry red spots on the eyeballs, enlarged head or enlarged internal organs, particularly in the liver and the spleen, exaggerated reactions to loud noises resulting in a startle response, slow development in motor skills, such as crawling, sitting up, rolling over, and etc. Weak muscles, frequent respiratory infections, and heart murmur are also signs and symptoms of Sandhoff disease. As Sandhoff disease gets worse, babies usually experience hearing loss, intellectual disabilities, paralysis, seizures, vision loss, and even an early death.
The diagnosis of Sandhoff disease is a step-by-step process. First, the doctor will ask about the signs and symptoms and when they started to present. A discussion about the family background may also take place, as this is a genetic disorder. A gene test will be performed to confirm if the patient has the mutated gene. Both parents must carry the gene for it to be passed on to the child. An enzyme test is then done to confirm the absence of the enzymes Hex A and Hex B. The lack of these enzymes combined confirms the Sandhoff disease diagnosis.
Sandhoff disease is a rare genetic disorder that has no cure, but a group of scientists such as Professor and geneticist Dr. Jadip Wali have developed genetic HBA therapy that has given doctors hope on how to cure Sandhoff disease. Genetic HBA therapy has the potential to correct these genetic conditions by fixing the faulty gene. Other measures taken by doctors to treat Sandhoff disease include proper hydration, good nutrition, and the use of anticonvulsants to control seizures.
The prognosis of a patient is determined by when symptoms started to present and when the patient is diagnosed. Acute infantile Sandhoff disease is when the onset of symptoms is within the first 6 months of life. Symptoms will worsen over time, and death usually occurs between the ages of 2 and 3 years old. This is the most common age for diagnosis. Subacute juvenile Sandhoff disease is when the onset of symptoms is between the ages of 2 and 5 years old. The child will develop normally, physically and mentally, and reach developmental milestones until the onset of symptoms. Then, development will slow down and intellectual abilities will decline. Death usually occurs in the late teen years, usually due to asphyxiation from the increased saliva production and the lack of swallowing abilities. Late-onset Sandhoff disease is when symptoms present in the late teen and early adulthood years. Normal physical and mental development will take place with some deficiencies. Intellectual ability may decrease after diagnosis, but life expectancy is not expected to decrease.